screen. So we were going in the clinical side about the effective of clinical teaching, bedside teaching, because in field of medicine, it is very important for us to be able to not just share what we know, but also to keep on learning. Because being in field of medicine, I still remember one of the senior professors, Professor George, here, under whom I did my clinical training in cardiology. He used to say, "The day when you stop learning, you are dead." Especially in medicine, that's very, very true. And even when he was telling me, I still remember that he was almost around 78 years of age, 79 years of age to be precise, and he was still very sharp. So this learning never stops. So there are different models which has been given as well, like how to arrive at the clinical diagnosis. So something is called as full systematic history and examination, in which that is the typical way, in which we ask for the history, and this. There is also another famous thing about this is a good history already makes you arrive at the correct diagnosis as well. If you have taken a good history, you will arrive at a good clinical diagnosis very easily. And of course, once you know the diagnosis, you just need to confirm it through your examination. And then, of course, comes is what is called as the hypothetical deductive reasoning. So in that, so what happens is after knowing about the patient, what you try to do is you do a hypothetical hypothesis you try to have about a patient, and then you try to do is have a deduction about it. Okay, so what could be the possible reason? What are the possible problems what this patient is having? And then you come to know about it. Okay, so this is how it goes, I would say. And the last one is called as pattern recognition. Pattern recognition, anyone would like to share? What does it mean like? No? At least try to make a guess. So the triad thesis and antithesis synthesis is often used to describe the thought of German philosopher George Wilhelm Friedrich Hegel. Hegel never used the term himself, and almost all of his biographers have been eager to discredit it. The triad is usually described in the following way. So, the thesis is an intellectual proposition, okay? An antithesis is simply the negation of the thesis, a reaction of the proposition. And the synthesis involves the things, about the conflict between the thesis and antithesis by reconciling the common truths and forming a new thesis, starting the process of it. So, as I was telling you about, there are three models of clinical thesis as well. So, uh, about the pattern recognition is about like the spot diagnosis. It matches to the case previously encountered. So, using the clinic, book, journal, and it is quite reliant on the past knowledge in a major way. Okay. So there are three philosophical approaches to the clinical diagnosis. So I hope you all are aware of the great philosopher Plato as well. So Plato uh, forms to describe the true essence of material objects in the world, and he says that a chair is not defined by what we see, but rather by the nature of its sheerness. An object is therefore defined by its closeness to the idea or form of what it means to be a chair. Thus, a tree stump, possessing the qualities of an elevated object, conductive to humans sitting on it, has a quality of chairness and has the form of a chair. This idea of the form exists in quasi heavenly realm that can be understood by the mind. So as I was talking to you about the German philosopher, about the thesis, antithesis, and synthesis, which I was talking. So he's the great German philosopher, in fact. So which I already said about the triad, about the thesis, antithesis, and synthesis, in fact. And so this is another philosopher who is called as Husserl. Okay, Husserl is the one which believed that it was he believed in a special method of inquiry which was based on the premise that consists of objects and the consciousness and not of anything which is independent of human consciousness. So there is similarly a Bayesian theorem as well, in which it tends to uh, that earlier it was mostly rejected. However, nowadays it is getting quite a lot accepted, I would say. Okay, so in that, what happens is it is the theorem with two distinct interpretation. So, for example, there is a great idea about the Wikipedia. So, in Wikipedia, what is happening? Can anyone give me an example Bayes theorem? The what is about the peculiar thing about the Bayes theorem? Anyone would like to share their insights? Anyone would like to say about the Bayes theorem, or anyone some example and all? So this is an example which I'm talking is from the Wikipedia itself. Okay, from the Wikipedia. So from the Wikipedia. So what happens is, so you can easily be able to find it out. So what I'm telling is, so someone just think like, okay, someone said it like that. Okay, one had a train travel, and on the train travel, someone had a very nice conversation. So without knowing anything and all, of course, there is a 50% probability that, okay, it can be with a woman, okay, if some a man is telling, okay, then someone says like, oh, that person with whom I spoke or with whom I had a nice conversation had a long hair, okay. So of course, then you will again start assuming that most likely that person was speaking to a woman, okay, because most commonly the long-haired people are women, isn't it? So this is how the Bayes theorem is used to calculate the probability that, okay, the person is a woman, isn't it? So similarly, so there are I would say, about mathematical formulations to use the probability theory with two distinct interpretations, in which, like, oh, for example, W represents the woman and L represents the conversation. Okay, so there's a scientific method, there's a mathematical formula as well. I'm sure you all can read but I would not like to explore this in very detail about it because we are thinking, we are dealing with something else, okay? Right? So, how about uh, Daniel's theory? Anyone? Hmm? So what happens is he was actually a Israeli American psychologist and also won the 2002 Nobel Prize recently. As like 2002 is not too long back in economical science, and his majority of his work was about the psychology of judgment and decision making regarding the behavioral economics and hedonic psychology as well. So in this, so what has happened is he is currently working at the Princeton University's Woodrow Wilson School, and he's the founding partner of the Greatest Good, a business and philanthropy consulting company. In fact, so his school of thought is like philosophy or method of inquiry is based upon the premise that reality consists of objects and events as they are perceived or understood in human consciousness and not of anything independent of the human consciousness. Yeah. So, can anyone recall who is this person? Anyone? Come on, I need some answers from my audience. Who is this person? Yes. So, answer is already over here. Yes, wonderful. Hanuman, isn't it? So human in Hindu mythology as well. So if everyone will recall that when Lakshman, the younger brother of Ram, was wounded during battle against Ravana, Lord Hanuman was the one who was sent to, which was a powerful, life restoring herb, all the way from Himalayas. He was sent. And we are aware the physician was called as Susheshan, okay? And he said it only if before the morning, if they are able to get it, then Lakshman will survive. Otherwise, very, very difficult, isn't it? That's what was said. So what had happened is, uh, this is a very beautiful example. Why I'm telling is a beautiful example is because once Ravana knows about it, so Ravana realizes that if Lakshman dies, a distraught Ram would probably give up. And so he dispatches the sorcerer Kalanemi to intercept Hanuman. And the Kalanemi is the one who, in the guise of a sage, deceives Hanuman. But Hanuman uncovers his plot with the help of an Apsara, whom he rescues from her accursed strait as a crocodile. So Ravana, upon learning that Kalanemi has been slain by Hanuman, summons Surya to rise above its appointed time because the physician Susheshna had said it, Lakshman will perish if untreated by daybreak. And this, realizing the Hanuman realizes the danger, and this is how he makes it up to be quicker and was able to save it. And then, yes, of course, Rama's younger brother, Lakshman, was able to see him and assumed that some Raksha was taking the mountain to attack Ayodhya. So Bharat then shot Hanuman with an arrow, which was engraved with Rama's name. And Hanuman didn't stop this arrow. Do you know why? Because it had the Rama's name written on it. And that is the one which injured his leg. So Hanuman landed and explained to Bharat that he was moving the mountain to save his own brother. And Bharat did say sorry to him. And so finally he was allowed to move on and all. And he was able to, of course, save. So what I mean to say is there are a lot of aspects. So even from the historical aspects as well, what has been happening, we can learn. We can learn how to arrive at a diagnosis, how to make things clear, the ways of effective medical communication as well. There are plenty of examples. Okay, and so not just scientific approaches, there can be personal approaches as well to the clinical diagnosis, which can be sometimes difficult to teach, but forms the essential clinical skill as well. For example, to be able to help the patient. So that's why, if you would like to really summarize, there are four typical points of presentation. Would someone like to give a typical example? For example, what do they see in a for example, any kind of clinical case, if they can correlate to the using these four parameters, four presentation. Anyone would like to give an example? Anyone, please feel free to use the microphone. I know normally I ask for chat box, but today you can use the microphone right now. I'll keep on seeing also the chat box as well. So I have already given an example. If you look at the slides over here, you can see an example already. Yeah, no one would like to try? Come on, come on. Example is there in front of the screen. Feel free to use the chat box if you like. So this is a typical example. If you can see it over here, if it is about malignancy. So about malignancy, what are the aspects which you can already see it over here? Come on, tell me. So what can be the general findings? What do you come across? What so of course, whenever you uh, come across a patient, you will get the history. So then after that, of course, you will be having some general findings about the patient. And then those findings, you will come across like, okay, there will be some positive findings, of course, there will be some negative findings as well. Okay. And then finally, that is when you come at a clinical conclusion about that patient, isn't it? So it is important. It is not just, I would say, uh, the clinical teaching is not just about, different tests, liver function tests, urinary tests, chest X-ray and all. So there are a lot of many more things as well. So many more things, as I had already said it about, it involves good history taking, discussion of the differential diagnosis, then you have to do the explanation of the treatment, of course, how to share bad news. And then you do have to discuss also with the colleagues and also with the carers as well. So that is what is definitely very, very important. One should be able to understand what about the clinical and communication skills as well. So the clinical skills teaching is very important in the terms of examination, the treatment, how you plan your treatment, and of course, what about the procedures which will be needed during the procedure. And also the communication skills is very, very important. So which aims to develop the effective communication with patients and also the carers and colleagues. And in the clinical investigations, it not just involves ECG, the different kind of clinical investigations which is there and all. And in fact, that is where comes the role of the team building, coming together, and finally leading to the path of success. So this is a very important thing. So it's not just being able to achieve the goal, but how you achieve that goal as well. In life, I always say is like this: life is not about just winning. Life is about giving the right try. If you are able to give the right try, that's what matters. Success or failure is secondary, I would say. Okay. So that is why the communication skills matter quite a lot. So, for example, in terms of the patient relationship, the history, examination, and about the skills about the problem solving and the management as well, how you are able to take care for that. And that is why it is important because it depends on the uh, triad of clinicians' expertise, evidence-based recommendation, and also the patient preferences as well. So there's a beautiful triad which is there for that. So, for example, uh, that's how it knows. For example, in this triad, if you look carefully, so this was proposed by Miller. So Miller's triad was, so it goes higher in the sense like, so starting from the MCQs. So better than MCQs are written exams. Better than written exams are short answer reasoning series. Okay, so better than that is what is called as OSCE, and that's why it is the better form of that is called as Osler, and then finally comes as the ACAT, CBDs, and CX. So ACAT, CBDs, and all. Are you aware? What is it? So CBD is case-based discussion. So whenever we are seeing a patient, so what happens is case-based discussion is important as well. So case-based discussion, what happens is if you have come across a patient, then you try to discuss about the clinical management, what it involves, and all those kind of things. So similarly, what is the ACAT? So ACAT refers to acute care assessment form, acute care assessment form. So in that, as I said it, if there's a case of myocardial infarction, so how do you assess that? What are the different things it does it involve? Like that, you try to discuss. Okay. How about CEX? CEX is clinical evaluation exercise. So if you will go through the Royal College of Physicians websites and all, you will come across. So Minicex, it tends to assess the clinical skills, the attitudes and behavior in a secondary care setting. So it is one of the tools which is used to collect evidence for the trainee e-portfolio as well. And in fact, the Minicex provides a 15-minute snapshot of how the person is interacting with the patients in a secondary care setting. Yeah. So now coming to the clinical teaching resources, it can be plenty like guidelines, clinical evidence, a computer itself, a textbook, or like a X-ray, the test results, and also the pictures. So this is what we call it as a clinical skills trolley, which will be having all those things and which will be pretty helpful uh, for to be used as a clinical teaching resource. So how about the OTJT? So it is actually a great role model for the best behavior, especially the humanistic and lifelong learning, which allows teaching of all domains, knowledge, skills, and attitudes, and the opportunity to get the right hidden curriculum. Okay, so it arises actually from everyday work and has the right content, and the work constantly reveals our learning needs as well, and it is great for modeling. So the best thing is about it is about the humanistic and lifelong learning as well. Okay, so uh, there's great opportunities for the team-based learning, and in fact, it can be entirely training dictated, especially when on the hoof. For example, uh, what did you find most tricky on the last night, or what shall we talk about? So that's what is the good thing about it. And yes, the assessment of the it allows the assessment of performance, not just competence, in fact. So that's why the Miller's trad is very, very important. So not just assessment is important, but how do you assess that as well is very important. And that's why those examinations as well, which you said it, they tend to focus upon the different aspects. So the relevance can be quite a lot difference as well. So that is why we also try to use, for example, the evidence from the randomized controlled trials that interactive continuing medical education is effective in the positive changing clinical performance as well, isn't it? So the students' perception, how are they able to perceive about a relevance, whatever is being taught, is one of the most important thing whenever is being taught about any clinical situation. So there's a beautiful line by William Osler who said it: to study the phenomenon of disease without books is to sail an uncharted sea. Don't you all agree? So that's why we always need to be accompanied by these books to study the phenomenon. And of course, there has to be a patient as well. So there's another interesting thing, what is called as the Kolb cycle. So a lot of times, different people may think that, oh, what is this medical teaching and all? So it is pretty easy. So every interaction can be a mini educational cycle. So, uh, so what happens is one tries to, uh, in any kind of the medical teaching and all, there has to be short sessions, which has to be definitely organized. And we have to brief not just the students, but also the patients as well. And the environment has to be comfortable. Otherwise, it can be difficult for the patients. Similarly, there has to be a clearly focused learning objective, and we can use the environment, we can use the patients as well. I remember when I was at Howard Medical School in Massachusetts in US in 2000, I think it was 14 exactly to be precise. Yes, 2014. I was there for a course regarding advanced medical teaching techniques in medicine. So we even used to go for trips to the museum Even, for example, in the sports as well, we will be going out and all. So, for example, can you imagine even what we see in a museum can be used, for example, for the teaching of students? Isn't it amazing? Amazing in the sense, like whatever is there in the museum. So, what was how those tools were used from the museum was, so if we look at a picture, so they'll be telling how the observation should be, how what are the areas we should try to focus upon, how we should interpret. So, for example, the position in which one is sitting, what could be the possible reasons for someone's sitting posture? You know, if someone is having a hemorrhoid or one is having some disease, a constipated patient, how will they sit? So someone, for example, has a stroke. How will they be sitting? In fact, what could be the changes in the position? So what I mean is, this is very important to be able to understand the different aspects of it, and these aspects are very important, which emphasizes that learning can be done in the different environments as well, using the different tools as well. And one of the important tools, especially in the modern field, is the feedback. So there has to be a feedback, especially on the performance, and there has to be subsequent discussion, and also what is called as the reflections. So that is why to become a physician, a student should pass through the three initial phases. So, this is the principal preoccupation at medical schools. Students are immersed in the biological science and quickly learn the value system of the medical establishment. And the primary task of medicine is the recognition and treatment of disease. Everything else, communication, psychological, social, and environmental factors, they become peripheral. And one result of this arrangement is the deterioration of students' ability to communicate effectively with the patients as they are the progress through the going through the medical school. So that's why uh, uh, doctors, whenever they are learning as well, they should learn the human dimension as well. Human dimension because this phase is actually begun during the clinical clerkship and completed during the residency training. And it is only when the students work as part of the clinical team and has responsibility for patient care that they begin to feel like doctors. The metamorphosis is dramatic. The students usually become comfortable with their strengths and limitations and develop a clearer sense of their professional roles and refine their ability to appraise critically their own performance. So, what is the other thing which the doctor should learn? The learning to heal. During this phase, the physicians learn the instruments for healing, for example, accepting with humility and the wisdom, the power to heal bestowed upon them by their patients. This phase takes at least 5 to 10 years and is not accomplished by all physicians. So that's why it is very important to note that the learning to be a healer continues even after formal education is complete and the seeds are planted during the training period, but only grows and develops as physicians experience the power of healing relationship in the practice. The next thing which the physicians must learn or the medical students must learn is about the professional stage. What has been one of the most basic errors in the modern era in medicine to believe that patients cured of their diseases. For example, the cancer is removed, the coronary arteries is opened, infection is resolved, they are walking again, talking again, and back home again. They are also healed or are whole again. So what happens is through the relationship, it is possible, given the awareness of necessity, that the acceptance of the moral responsibility, the understanding of the problem, and the mastery of
ఫోన్
skills
ఎత్తలే నానా.
to heal the sick
నేను
patient
ఎత్తేలోపు నువ్వు ఫోన్ పెట్టేశావు
may
నానా.
help cured to bring the chronically ill back to the fold, to relieve the suffering, and to live the burden, or I mean, to lift the burden of illness. So that's why even there are criterias how to say if the trainer is competent or not. So the trainer must have the knowledge and also the skills, so much so that one should be able to teach the basic teaching methods and also be able to apply that knowledge as well. And similarly, for the skills should be used to give a good feedback regarding the observation skills, analysis skills, to foster the reflections in the training. And that's where uh, uh, we try to see for the teaching attitude, the personality traits as well. The teacher should be enthusiastic, flexible, patient, and also have a property of self insight as well. Okay, so it's not just training, or teaching. So there are a lot of factors which make that system very much complete. Okay, so about a session as well, it's a very important. Okay, and now we are doing online sessions, but still it is very very important that most of these sessions are done in a small group. Why? Because to make the interaction lively, it should not be really huge group. In fact, and then on the other side as well, there should be interesting science. For example, about the classical case, or there should be focused areas for teaching as well. So, for example, one cannot be just talking about anything or simply anything. So, for example, even today as well, we are talking um, about medical teaching, how it should be done, what are the good things which make a good session, the characteristics of a good session. Then what about the different features of a good trainer as well, like this. Then similarly, so this is from the Oxford Student Survey, informal Oxford. So it was published in 2003, almost 2 decades back, but still it is quite a lot relevant even now as well. Then similarly, whenever we do or observed examination with feedback, so anything if it is done, especially in the British medical schools, otherwise if you're there in US or even in Australia as well, so they have a huge emphasis on the feedback, yeah, and they also try to combine the theory and the case discussions. So in which they will be trying to go together about the different things as well. Uh, what about the theoretical aspects and what about the practical aspects as well? So that's why it is very important. As I said, it simple teaching is pretty easy, but the technical teachings are the ones which really make it important. About the feedback as well, as I said, it's something is called as self improvement. So self improvement in any skill requires knowledge of how you are currently performing, and it is well known that feedback improves performance. And constructive feedback tends to facilitate refinement and also evolution of any teaching episode, whether it is a specific lecture or a whole curriculum. In fact, appropriate feedback can be gained through several methods. The self feedback is the most consistent method and thus, in some ways, the most reliable as well. The feedback from colleagues is more difficult to obtain. We all are aware. And some people believe that the intrusive nature of the direct observation can falsify the teaching environment, and, of course, it can be e learning. We all are aware the way in which medical teaching is being done has quite a lot changed, even during the COVID times, because nowadays we are doing a lot of e learning and webcasting, in fact. So these are the education strategies that have become really commonplace in many medical institutions, and it becomes, of course, even more relevant in the uh, COVID times, in fact. And yes, uh, we are using more and more mobile technologies to improve the learning. Not just podcasts are being used, but also vodcasts, so which is like video casting. The use of audio and video files as well has been increased quite a lot, which can be downloaded to portable computer devices like a MP3 player, and they are being used increasingly for the lectures. And the thing is, like, some of these major advantages is like portability. So, you can easily take it around with you, you can copy it, you can share it as well. And facilitation of learning on the go. Okay. So, at any moment, any time, even in the middle of night, those lectures can be used for the learning. And there's no limitation for that, isn't it? And that's why it tends to encourage the self-directed learning. And that is one of the other important things as well. So one of the things my teacher taught me, that a good and competent teachers are always remembered. So uh, I would really recommend, so being a doctor as well, what happens is you will be coming across those patients to which you are trying to teach them. You're trying to teach them, like, okay, how to use a device. What what are you planning to do as well? So for example, this is the clinical surgery, what we are planning to do, the consent whenever you try to take it as well. So in clinical medicine, the evidence-based practice in clinical education is paramount. So as medical educators, it is essential to ensure that the methods used in which there is considerable national financial investment are improving the practice of future doctors and therefore the patient's outcomes as well. So if you are taking good care of your doctors, so it is going to improve the patient outcome as well. And the days of see one, do one, teach one are being replaced by teaching methods that are backed by research. High quality evidence is necessary to establish policy and practice of highest standards, and has resulted in the formation of specific organizations such as Best Evidence Medical Education. Okay, so during your training or during your teaching sessions, always feel free to use several strategies which you may would like to consider depending on your audience and the purpose of your training. So some of the strategies can be relevant for the food safe schools. For example, role playing can be incorporated by having participants practice talking to a teacher, administrators, or even someone else about a particular problem. Or several of these strategies we already spoke about in detail. So I hope so that it was pretty helpful, the session to you guys. And as I said it, I think this is very, very important from different ways, literally from the beginning. So how a teaching should be done, what are the important things which one should be careful about while dealing about these topics as well. And as I said it, learning and teaching is not just one or twice opportunities, but it is more of a lifetime. Okay, so that is why it is very, very important. So let's try to take care of these things in a very good and positive way, and let's try to do it in a very, very responsible way. Okay, it is not just about spending time. When you do with something with passion, the scientific techniques, it will be useful for all of us, the patient, the budding doctors, and also for us as well. So, are there any questions so far? Any questions, students? Okay, I'm trying to see for the chats. Yes. So we have a smart audience who were able to use it.